All right. Everyone, Dr. Clint Steele here, and I am here with Toby and his mom, Megan. We are on, if you guys have been following our series, we've been doing a series on Toby's 5 months, right? He came in with, didn't turn his head, right?
Right.
His side of his head was starting to flatten out. You were concerned about that.
Yep.
And then also he had a lot of congestion in his sinuses and in his lungs.
Yep.
And you weren't really concerned about that because the doctor told you it wasn't a big deal?
Yeah.
Am I right or
Yeah.
not? Look,
No,
you can
yeah.
look at the camera, seriously.
Yeah.
And so we started working the first time I adjusted him, if you remember. This is an adjustment, by the way, guys. For a baby like this, just like this. Okay? Hardly any pressure at all. Normally, not any pain whatsoever. However, the first couple times I adjusted Toby, he started crying when I pressed on him, which is a bad sign.
Yeah.
Okay?
Yeah.
And that's a sign that usually there's a misalignment here, and that can happen in newborns during the birth process, or if there's a problem with the birth process, there was a C-section in your case.
Yeah.
But we found a subluxation here, some nerve interference here in the neck that was affecting his ability to turn his head. That's why his head was always turned to one side.
Yeah.
And so what, maybe a week, 2 weeks into it,
Yeah, I think too.
he started turning his head, no
Yeah.
problem, right?
Yeah.
I can adjust him now, no pain, he doesn't cry, nothing. Now the second issue was he was having, like I said, a lot of congestion here in his chest and in his sinuses, and I could hold him here and I could hear the wheezing.
Yeah.
And again, no official diagnosis from the medical doctor saying, you know, he has asthma or he has sinusitis or anything like that.
Right.
Right? Ear infections, nothing.
Nothing.
But you heard it.
Yeah.
Okay. And you weren't really concerned about it? Or were you?
No, 'cause they told me there was nothing.
Because the medical doctor said we're just going to keep an eye on it,
Yeah.
right?
Yeah.
But I'm telling you guys right now, if anyone's watching, you have a baby that has something similar, it's going to lead to something, okay? There's always a cause of something. And that congestion was going to lead, I guarantee you, it was going to lead to either ear infections, sinus infections, it was going to lead to asthma, something like that. And so what we had to do was take we had to change his formula.
Yeah.
Because we pulled out his formula and the three ingredients, the three main ingredients were, remember?
Corn syrup.
Corn syrup,
Some milk base.
some milk base,
And then sugar.
and sugar. Those were the top three ingredients. And I'm not getting on Megan for this because that was the formula that was recommended by her doctor.
Yeah.
Just so everyone knows. So make sure you read the ingredients. Top three, sugar, corn syrup, milk. Okay, almost always in kids that have any kind of congestion, it's usually milk related because most kids or most people are actually sensitive, if not fully allergic to milk. Okay, casein A1. So we took that out, and what's happened to his congestion?
It's gotten a lot better.
It's pretty much almost gone. Once in a while you hear a little bit, but I mean I could be sitting here like this with him, and I could hear it in his chest, I could hear it in his sinuses, and it's pretty much gone now. So that's the progress on Toby. We're going to continue seeing him. We're going to start dropping down his frequency, but we want to maintain his nervous system function because we want to make sure that his immune system is functioning properly because his nervous system, your nervous system controls immune system, cardiovascular system, reproductive system, all that stuff, respiratory system, everything.
Yeah.
And so it's very important, guys, that as parents of newborns, that you get your kids checked out, keep them checked out, keep their nervous system functioning the way it's supposed to. So thank you for trusting me with this health. I appreciate it. Thank you.